Good afternoon. David Sweat, Deputy Director, Shelby County Health Department. I'm joined today with Chief Doug McGowen from the City of Memphis. Welcome to the City of Memphis and Shelby County Joint COVID Task Force press briefing for April the 27th. Starting with the numbers, locally in Shelby County, 94,974 cases of COVID-19 have been diagnosed so far in the epidemic. Up in Tipton County, we've had 7,269 cases reported. Fayette County, Tennessee, 4,959 cases have been reported so far. In DeSoto County, Mississippi, 21,238 cases have been reported. And in Crittenden County in Arkansas, 5,614 cases have been reported so far. In Shelby County, the case count went up by 118 new cases yesterday, and we are holding steady at 1,613 deaths from COVID disease in the last year. We have vaccinated more than 500,000 doses of COVID vaccine have been delivered to 306,758 people as of yesterday. There's 101,910 people who are partway through their vaccination series, and 204,848 Shelby County residents are fully vaccinated at this time. With that, I'll invite Dr. Doug McGowen to the podium to tell us about the progress on the vaccine campaign.
Thank you, David. I appreciate that. And as David said, we have 511,000 vaccines that we've administered. That's across all of our health systems, the public pods. That is the number of vaccines that have been delivered to people that live in Shelby County. And as David said, more than right around 310,000 people have received at least one, and 207,000 fully vaccinated. So we are making progress. We are seeing a decline in demand even from last week. And so we're doing everything we can to get the word out about availability. One question that I know people will have is about the recent approval of Johnson & Johnson vaccine for reuse. We actually are issuing that out today. We have homeless and homebound programs that are giving people the option of either the Pfizer or the J&J vaccine. We will be making the J&J vaccine available to individuals as for sure next week. It will be regularly available, and we'll rotate around the city, so look for an announcement about where that might be. And then later this week, if there is an opportunity, we will also introduce J&J, but it will become routinely available in the coming days for Johnson & Johnson. That will be your opportunity, should you choose the one-shot vaccine, to take advantage of that. We know that there's been some announcements about releasing some of the restrictions. There was a request that came out of Governor Lee's office and looking to do some changes by Memorial Day. The good news is we have about 30 days to evaluate that. The City of Memphis, as you know, has a mask ordinance in place, and our legal team is looking at what impacts the governor's request, and should there be a change to the Shelby County Health Order, what impacts that has to the City of Memphis's mask ordinance. And it's clear that in some communities where they have a very high level of vaccination, that it's probably reasonable for people to request that. But remember, our percentage is not as high as some other communities. And so we're not there yet to the point where it's reasonable to lift a mask requirement. We need more people to be vaccinated before we even begin to have that conversation. The vaccination campaign is largely down at the grassroots level now. I've talked about this before. It's not just the message, it's the messenger. We are doing all we can at the macro level to get the word out about the availability of vaccines, availability of vaccination sites, and engaging large groups of individuals with a message about having our best shot of getting out of the vaccine. So now we're at the grassroots level, and we would ask everybody, if you have received your vaccine, to share that story with other individuals and bring someone to get their vaccine. We think that is how we're going to be able to get more people through, is at the grassroots level, potentially smaller level engagements with people that they know and trust, and can assert that the vaccination process was well worth doing. So we would ask all of you to encourage your loved ones and your friends to get a vaccine. The last thing I'll say before I open up to questions is we still do retain a very high volume capacity of getting vaccines. I want to make sure that people aren't confused. When we say no appointment is necessary, we mean just show up. We don't mean there's no appointments available. We mean lots of appointments, lots of opportunity to get a vaccination. So that is true at all of our sites this week. We have the opportunity for you just to show up and get vaccinated, and that's what we would ask people to do. For individuals who do want an appointment, we still have some appointments available this week. And if you go to covid19.memphistn.gov, you can sign up for one of those appointments, and we can assure you that you'll be in and out very quickly. Our wait times are well under 5 minutes so far, late last week and early this week, over the weekend. So it really is quick, it's convenient. You can be in and out and still make it on your lunch break or before work. So with that, I'll stop and I'll take any questions that people may have.
Sam Hardiman, Commercial Appeal.
Doug, my first question is for you. And so when you say the city's legal team is evaluating what effect any order from the governor would have on the mask ordinance in the city of Memphis, does that mean if the city is allowed to, the city would extend its mask mandate for as long as the city feels it needs to, regardless of what the governor says?
Well, remember, it wasn't an order, it was a request, and it was just an announcement that they may ask the big 6 communities that have a separate health department. So that really goes to the health department's order. And then what they're evaluating is what's the impact of the city ordinance vis-a-vis the Shelby County health order of the health officer. So it's too early to tell, Sam, whether we would continue that. I'm saying we want to make sure that we're legally correct, that the ordinance still has standing with respect to what the health order is and the request from the governor. So I'm not talking yet about whether we will extend that beyond that date. I'm saying as of today, I don't want folks to get encouraged that we would be taking the masks off in the next week or two. Clearly this was a few weeks down the road, so we're asking our legal team just to look at the standing of the city ordinance vis-a-vis the health order.
Sure. And this question is for anyone but Dr. Sweat or Dr. Randolph in particular. When would be a good point from a public health perspective to get rid of the mask mandate?
Well, David, take that one on.
So thanks, Sam. As far as the guidance on masking, that is something that continues to change and evolve over time. We know that the Centers for Disease Control, for instance, has just issued some new guidance right as we were about to come onto the air, so we've got to look at that guidance. My understanding is it has to do with recognizing that not wearing a mask outdoors for vaccinated individuals in small groups is probably okay, but we need to look at that language. We also know that Governor Lee has made a request to the 6 counties. Our numbers have been relatively stable for for a few weeks, but we continue to evaluate that because the reproductive rate of the virus is still above 1. We do recognize that it would be simpler for citizens if everybody was on the same page. When you're talking about from county, city, county, state, federal, if everybody's on the same page, that makes it easier for everyone. And we're continuing to evaluate the data and have discussions with local experts before any changes are made. We do constantly try to align to best public health guidance, and we also want to be respectful of at least the considering the request, certainly from the governor. But it's possible some tweaks to our ordinance might be issued in the coming days, but those have not been determined at this point in time.
Dominique Dillon, Fox 13.
Doug, you mentioned that the J&J vaccine may be available for people who are not homebound and homeless by next week. How soon will they be able to begin booking appointments?
That's a good question. So we'll look to have our appointments up and online by Thursday. So I guess that's 2 days from now. We have already kind of booked out our appointments and our availability this week and let everybody know that we'd be doing Pfizer at our locations this week. And so rather than changing over any one specific area where somebody may have a plan to go and get Pfizer and then changing that up on them. So next week for sure, if we can do it earlier than that, then we will, but next week for sure, and we'll try to get that schedule out by Thursday so people can sign up. And I do want to be clear that part of this is a logistics issue. Managing these vaccines, which have very close temperature controls and chain of custody, is difficult enough with one vaccine on a site. So the logical question is, well, why don't you offer a choice at each site? That essentially doubles the chain of custody, doubles the complexity, and quite frankly, significantly increases the likelihood of error. And so we're trying to keep them discrete at each individual site. So that's why we're trying to put a schedule into place so people can, A, for chain of custody and consistency, but B, so people can predict where and when they might be able to get that.
And will you guys continue to offer incentives to get people to come out and get vaccinated, or will it more be word of mouth and people trying to convince their friends and family?
So we did try some incentives, and we did have a bit of an uptick, so we're reevaluating the look there to see what we think the actual impact was. We will continue to consider all approaches to getting more people vaccinated. There are several other incentives that could be considered, but largely it's the right thing to do to get yourself vaccinated for your friends and your family. So we're encouraging word of mouth and, again, messengers to carry that message. We did see a bit of an uptick, as I said, with the gift cards that we put out. We had some gift cards available over the weekend at several locations, and we still did not get the response that we expected. The jury's a little out yet on whether that specific incentive worked or not, but we'll continue to look at all the options.
Kelly Roberts, WMC.
Good afternoon. A question for Doug or David. How were you guys aware that this announcement from the governor was going to come today? Any of you all part of the discussions? It sounds like either Governor Lee or members of his office reached out to city county leaders. Anyone part of that discussion before this announcement came earlier this morning?
No, not to our knowledge. Certainly for David and I's level, we had not been part of that conversation. And we do a regular and recurring discussion with the Tennessee Department of Health on almost a daily basis. So that had not been part of our discussion.
And David, I know that you said that numbers are stable. We still have that reproduction rate over 1. Can you emphasize any other kind of triggers that you see possibly in the foreseeable future that, may make this discussion of, ending a mask ordinance or a mask mandate, a little bit, a lot to talk about? Anything that would give you concern in ending this ordinance or mandate by Memorial Day with the numbers that you see now?
Thank you, Kelly, for the question. I mean, we're still evaluating the guidance that's just been released from the CDC and evaluating the requests from the state, et cetera. I mean, we have always made adjustments, and including adjustments to things like masking based on data and guidance from other reputable sources, and we're going to ask for the informed opinion of experts before any changes are made. So at this point, I guess we're in an evaluation phase of all of this. But what I will say about masking, remember a year ago, it was the masking that got us through the surge and got us out of the summer surge. So masks are very important, and we will only, after thoughtful consideration, make changes to our mask policy at this point.
Brad Broders, Local 24.
Hi, can you all hear me today?
Yes, hi, Brad.
All right, I'm on my phone, not my iPad today, so just making sure. First question's for Doug. Doug, if you could just provide us an update, any latest development regarding any doses potentially scaled back, any adjustments since Thursday? I know we're kind of at the halfway point of the 6 weeks, and I have a follow-up.
Sure. So there is still broad availability. We were allocated an additional 21,000 doses per week. There has been no scaling back there. We still have the ability to provide 3,000 doses a day at the Pipkin site through the Community Vaccination Center. We're obviously working with the team there should they decide at the federal level to scale back some of the presence here because of lack of uptake. There's a logical plan that they're putting into place to how to do that. But at this point, there has been no scaling back. There is no limitation on the number of doses. We stand ready. If people showed up this afternoon to take advantage of that, we would be ready and willing and able to, that'd be a half a day, so do another 1,500. And then if 3,000 people showed up tomorrow, we'd be ready, willing, and able to do 3,000 tomorrow.
Thanks. And I mean, is there any chance though I know we're about to start week 4 that could change, or are you under the assumption that the weekly allocation will not change these 6 weeks?
I think it's still too early to tell. Should there be a decision made that because the take rate on the vaccination site has been substantially under 3,000 a day, if they would choose to redeploy some of their folks, then there might be a decision to scale back on the allocation that we have. But what I don't want people to worry about is the fact that there will be a lack of vaccine available at the site. Remember, that's 21,000 additional federal doses that we're getting. We still have a lot of doses that are available to us through the state of Tennessee. So availability of vaccine is not an issue. What we were speaking about last week is it's not often that you have the opportunity with more vaccine and more than 100 people that come with it to administer the vaccine. That is the unique opportunity that we have in this community over the remaining 3 or 4 weeks.
Greg Akers, Memphis Business Journal.
Hi, Chief McGowen. With that disparity between the availability and uptake of vaccines, how are you managing the inventory you have or scheduled to have if you can't get those shots in the arms? Like, is there a risk or a certain date after which doses could start to expire or be wasted in large quantities?
There is always that risk, but if they're kept in the frozen state, then that is a really long window. It's really when they're thawed, you get into that 5-day kind of expiration, and that's what we monitor very closely. We're not at risk anytime in the near future of frozen doses reaching their expiration date, because that's a relatively long window. I can't remember off the top of my head what that is, but I do know that we have our inventory control system. We actually have that displayed in our Office of Emergency Management for every single lot that we have. So we know when it came in, what its expiration date is, both frozen, and then once it's thawed, we have that expiration date. We track number of days remaining until those expire.
Thank you. Regarding the governor's mask order, are you concerned that it confuses what you're trying to do in Shelby County if surrounding counties have different rules that they can follow?
Well, I think we had that conversation early on when there were other counties that either did or did not have a mask mandate. There were other counties that lagged a little behind where we were. So it's the same concern. We are one pool of people in this metropolitan statistical area. Borders don't mean much to human beings when you're actually traveling to and from work and to see families. And so the rules become a little different in different places, and it's easy for people to get complacent. The biggest thing that I worry about is that people say, well, it's over now, and it's not over. I don't know what the old saying is, but it's not over till it's over, right? And it is clearly not over here in Memphis and Shelby County. As David said a bit earlier, and as we were talking before we came on, yes, the cases are relatively flat, but it looks flat on the chart relative to the very huge peaks that we had during the pandemic. But flat is a relative term. There is a very slight upward trend to that line. And so that means that it is actually growing. And that is counter to what we were just talking about here. We're believing this is over. No, the pandemic is growing again. Slowly, for sure, but growing for sure as well.
Hannah Grabenstein, MLK 50.
Good afternoon. I'm wondering, I know we have the mass vaccination sites. I know we have the community pods. I know you can go to a CVS or Walmart, any of the partners. I'm wondering where we are in the process of people being able to go to their family doctor and get a vaccine.
Sure, that opportunity is available for anyone who is registered with the state of Tennessee as a provider. Part of the issue becomes with the family doctors for the Pfizer and Moderna specifically, where you have these very rigid requirements of storage, especially at very cold storage. And then also the issue that once you take a vaccine from a vial, for Pfizer, you have to have 5 other people ready to receive it within 5 hours, or that vaccine goes bad. And for Moderna, they have to have 10. So for every dose you draw, there are 10 in that vial. And so you would have to have 9 more people lined up. So it becomes a logistics issue for the doctor's office. A, the handling and storage, and B, making sure that you have enough patients lined up to receive it so that you're not wasting doses unnecessarily. Some of the larger outpatient clinics are able to handle that. For the individual providers, it's a bit more complex. The J&J does present a much more flexible option, but then that's only one option for individuals. So it's something that we are talking with the medical society about. We have spoken with the primary care physicians who are solo providers and those that are in a large clinic, and it really becomes a logistical and a management issue of managing the vaccine so that you're not wasting it.
Okay, thank you. And then my follow-up is, I'm looking at the vaccine demographic data from this past week, and it looks like 7% or less of the vaccines have gone to people under age 24. And I'm wondering what sort of campaigns the city is considering. How are you trying to reach out to younger people?
That's a great question. So we are trying to attack this from every level. And it's important for, young people have shown that they can come together to change the world. Young people have led a lot of the dialogue recently. I would love for young people in Memphis, Tennessee to lead the way and show that they are ready to get this behind them. Any large challenge our country has taken on, a large share of the burden is taken on by young people, and I would ask young people in Memphis and Shelby County to help us carry that forward. I'll say it today because I joked about it, and I'm not ashamed. I made a TikTok video. I am not a social media guy, but I made one just because you can't take yourself too seriously, and I showed myself getting the vaccine. I thought it was a fun way to share the message. I would encourage young people to go do something similar. We'd love you to take a picture, make a video of your experience, share it with your friends. If you go to our vaccination sites, we actually have a selfie station. We would love people to get a vaccine, get out, take a selfie, share it on social media with their friends. But all of those aside, our communications team is very focused on the younger demographic. Again, also trying to focus on men who still make up too few of the people that are getting vaccines. But you're right, we lowered the age to 16 and above, and it's time for the folks who are in that younger demographic to come forward and get your vaccine to help us all get through this pandemic.
Sam Hardiman, Commercial Appeal.
Hi, thanks for letting me have a second question. It's nice. To follow up, Dr. Sweat, a little bit, with when you say cases are flat and the transmission rate is just over 1, is there a specific metric public health wise? Is it 10 cases per 100,000 a day over a sustained period where the health department would look to get rid of a mask mandate and make masks a recommendation?
Well, I think there's several things there, Sam. On the first thought, we have not anywhere in public health, at the federal level, state level, local level, nobody has calculated a number and said, okay, when we get to that number, we can just toss out this, that thing, or the other thing. What we do want to help people realize is today we could easily get distracted into questions about mask mandate, take it away, keep it, whatever. But the most important thing is the vaccine. campaign. And right now, 33% of people in Shelby County are vaccinated. And 44% of the vaccine campaign target goal has been reached. The off-ramp, the escape route, the end of the road for the pandemic only comes when there are too few people left who have not been infected that the virus can find and infect. And the best way we have to get that number of susceptible individuals down as low as it can possibly be is to vaccinate as many people as we possibly can. And yes, wearing masks protects us from sharing our respiratory viruses with others and protects us from getting other people's respiratory viruses up into our nose and mouth. But when it comes to finding a way out of this epidemic, the vaccine is what's going to give us our pathway forward. And so it's very concerning that yesterday we were only able to add another 1,100 individuals to our local total of the number of vaccinated people. And for whatever reasons, people are slowing down on coming forward to be vaccinated. What I can tell you is that my personal experience with it was, as a person who's over 55 years of age, at increased risk of death, as a person with asthma, at increased risk of death if I get infected, that the overwhelming feeling I got when that needle went in my arm was an overwhelming sense of relief. I made it to the point where I could get vaccinated. And I was grateful for the opportunity to get my second dose and to now be more than 2 weeks out, because I know that for me and my family, it increases the likelihood that I'm not going to die this year from this, and I'm not going to bring it home to them. And what we would like is for everyone who has a vaccine story to share that story with whoever will listen, and for all of us to come forward and present ourselves to be part of the way out of this. By participating in the vaccine campaign, we have plenty of shots available. And that's the most important thing we can do today. And that still remains the most important thing that we can be focused on today.
Thank you for that answer. And as a follow-up, Doug, would you share that TikTok with the public?
Well, Sam, it's not a professional production, but I'll certainly share with my family and friends, and let's hope it goes viral. I think that's the right term. But in any case, I do encourage people to get out and share that message in whatever way you feel compelled. I'm trying to walk the walk here, and I tell everybody I can the same story that David said, just what an overwhelming sense of relief it was and some sense of freedom. I didn't even understand before I got the vaccine that I had this burden, and it was lifted once I received the second dose of the vaccine and being 2 weeks out. So just really trying to share stories and a lighthearted approach to actually getting a vaccine, because it really is part of what we can all do together to show some Memphis and Shelby County pride.
Those are all of our questions today. Are there any closing messages?
So thank you all for your continued coverage, for doing such a good job of asking great questions. We know that we don't always have a pat answer. I know the messages today about what's happening with the mask, the requests, the information from the CDC, from the governor's office. We will do what we have continued to do over the last year and several months, and that is to be here to answer questions to the best of our ability. As David said, we will make informed decisions about our approach and about what's next, whether it's on how we pivot the vaccine campaign, what we do with the local health directive. It's always informed by data and by evidence and what we believe to be in the best interest of the citizens of the community. And so we just encourage everybody to do their part to come on out and get vaccinated. We didn't talk about testing today. There's still plenty of testing available. You heard a week or so ago, it is still allergy season. Let's not confuse the symptoms of allergies with what could be a potential COVID infection. It's too important with the variants out there. So if you're feeling other than localized itching, sneezing, or stuffiness, and you're feeling some other kind of a fever or experience like that, please go get tested. But the surest way is to get a vaccination. And I sure would love to use up all the vaccine supply that we have in the next few weeks. So we can get more. So come on out and get vaccinated so that we can get out of this pandemic and enjoy a really wonderful summer and fall. Thank you.
Thanks, everyone. We'll be back on Thursday.